Professor Marietjie Venter is with the University of Pretoria's Medical Virology Department, and she joins us now via our video link. And Prof, it's great to have you on the program. Congratulations, I guess, are in order if that's how you're viewing your participation in this particular group. And perhaps let's start there. I mean, help us understand what the work of this group is, and more specifically, what the objectives of the panel are.
Good morning, Anna, and good morning to your listeners. Thank you very much for the invitation. So the SAGO, or the group, is basically the scientific advisory group for the origin of novel pathogens, as you said. And it's a group of scientists that will act in their own capacity. So we are independent and we're not getting paid, but we will advise WHO on the origins of new pathogens. So it's all experts that have a background in different fields of virology, of lab safety, of epidemiology, and so on. And they come from all over the world, so from many different countries. And they were selected out of over 100 different countries and 800 applications. So I am really honored to be part of this group, and then also to act as the chair to lead the group. Our role is really to advise WHO. So the findings of the committee will really be put out into a report to WHO at the end. So it's not open meetings, but our job is really to look at the literature that's out there, help WHO to come up with a framework of how we should probe new pathogens to prevent pandemics and local epidemics as well. And then what new studies needs to be undertaken on top of the ones that already been done to look at SARS-CoV-2 or the virus that causes COVID-19, but also other emerging diseases. So although this is the current emerging disease that we are worried about, there's been many viruses that emerged over the last couple of decades, and we expect to see more. So our job is really to see how we can come up with a plan to prevent future pandemics.
Right. Let's put that advisory panel into perspective a bit more. I mean, help us place its significance in a context where we're still trying to really find out where something like SARS-CoV-2 that causes COVID-19 comes from. In other words, how easy is it really to find the origins of pathogens?
Yes, well, in the case of SARS, it will obviously not be that easy, because it's been a couple of years now, really, since its discovery. But we will really look at the literature that's out there already, and the findings of other groups, and then try to determine how these type of spillovers happens to humans. In Africa, we've had many emerging diseases. So if you think about just back to the Ebola outbreak of 2014, before that, Ebola was originally discovered back in 1974, and we've seen outbreaks in small scale almost every year. Yet, nothing has really been done about it. And it was only when they started probing where this virus, Ebola, came from, that they really discovered bats, for example, to be a link to it. Then other viruses such as West Nile virus, which is mosquito-borne virus, originated in Africa. Also Zika virus, if you think about that, or chikungunya. It's all viruses that were identified originally in Africa and then spread internationally to cause large outbreaks and pandemics to a certain extent. They just transmitted differently. So for us in Africa, it's really an advantage to be part of this group, because often these these pathogens will circulate locally, and they won't be detected because we have so many other diseases. So if we not have a very active surveillance system to find them, we often don't see these diseases.
Yeah.
So to give you an example, for example, West Nile virus is a virus that's endemic to South Africa. And it's actually one of the viruses that I work on in my group as well. And we knew that it's here, but it was really very much underdetected. And when it emerged in the United States in 2000, around the year 2000, it's only really then that we started looking for it actively here. And we found that the strains that we have locally can cause similar disease to what we find there. And we've since set up a surveillance system in horses, also in mosquitoes and in humans, and we found many cases of severe neurological disease and death in humans and animals. So it's only by implementing these type of studies that we will really determine the impact of these diseases in humans in Africa.
Fascinating. You've answered this question in part, but perhaps it's worth asking it more explicitly. I mean, what are the unique advantages of having someone from Africa lead a panel like this? And I'm asking this in the context of a general sentiment that there isn't someone batting for the global south in these multilateral establishments or multilateral organizations like the WHO. Are you able to speak to that in any way, the kind of representation, for instance, that Africa will have in where these studies focus and what they prioritize?
Yes. So I think you'll be surprised how many South Africans are actually already involved in WHO as advisors. Just to give you an example, the influenza network for WHO stretched across the whole world. I was previously the National Influenza Center Director for South Africa, and we basically will look every year to see what influenza strains is going around, and then we have a meeting with WHO from all countries in the world, and we will ensure that the right strains are then placed in the vaccine that will also be relevant in Africa. So that is exactly why it would also be important to include us in studies with COVID-19 or other viruses that directly affect us. Many of these advisory groups in the past has been led by countries from the Northern Hemisphere, for example, and sometimes I do think that we are then neglected. So it's very important that we have our voice out there. But I'm just one of many experts in this group, and it's really bringing this international community together to have a better understanding of all these diseases that can emerge internationally, that will then also affect other countries and ourselves, and then be part of the decision-making group to see how to take it forward and prevent epidemics locally, but also these diseases emerging internationally and causing pandemics.
No overstating the importance of the work that you do and the task that's ahead. Thank you so much for breaking it down for us and for making time to share your insights. Really do appreciate it here on the AM Report. Professor Marietjie Venter is with the University of Pretoria. She's in fact at the Medical Virology Department. Once again, Prof, thanks very much.